It's my feel-good breakfast show.
Welcome back, everybody. You're just in time. We're opening up here on S3. Yes, it is Freedom Day, but it's also Health Tuesdays here on your Feel Good Breakfast Show. And we are speaking about meningitis. Now, World Meningitis Day, commemorated on the 24th of April every year, helps to raise awareness about the potentially deadly disease. Yes, it is deadly. It continues to be a serious global public health issue because it can kill in a matter of hours or lead to lifelong disability.
My anxiety levels are rising as we speak about this. 5 million cases of meningitis are reported every year. Children and adolescents can be most vulnerable to contracting meningococcal infections. And here to tell us more about meningitis and help us with our pronunciation of these terms is medical head and good friend of the show, Dr. Thinus Marais. Doc, welcome back.
Thank you.
I don't know if it's because I'm a parent or because I've kind of seen the way that this has been dramatized, but this is quite dramatic stuff. Maybe the best place to start with this kind of discussion is with a description of what meningitis and meningococcal
disease,
right?
Yeah.
Disease?
Well done, you nailed it.
Thank you.
So I think it's important to understand from a definition perspective, meningitis is an infection of the layers around the brain and around the spinal cord. So that's by definition. It's caused by many things. So we get viral causes, and then you also get bacterial causes, and these are the ones that we're more scared of because those are the ones that sort of progress within a matter of hours and have quite sort of serious effects. And three main causes, or three main bacterial causes globally: the meningococcal meningitis that you mentioned, pneumococcal, and then Haemophilus influenza. And because we're in South Africa, TB, unfortunately, also a cause of bacterial meningitis.
Blight on our society. Yeah.
What is the difference between the two, bacterial meningitis and viral meningitis?
Yeah, so it's just the causative organism. So bacterial caused by bacteria, and those are the ones that sort of progress really quickly and unfortunately have quite serious effects and can often lead to death. Not to say that viral doesn't, but as a sort of general rule of thumb, the viral meningitis is a little less serious. We see it can cause hospitalizations. It also obviously does have quite serious effects, but the bacterial one is the one that we're a little bit scared of, and I think for the purposes of today's discussion, thankfully, the bacterial meningitis are the ones we can prevent with vaccines.
With vaccines?
Yeah.
And you've been vaccinated, not for... Well, have you been vaccinated for that as well?
I have.
But maybe you can explain to us the process of what actually happens. Why is it so dangerous, deadly, in fact?
Yeah, so I think, and this is where we usually struggle from a healthcare perspective, is from the moment of infection to serious disease is a matter of hours. You know, it's with other diseases you often see a long incubation period, a sort of slow sign of symptoms, etc. But with the bacterial meningitis, it really can be as quick as 24 hours from infection to really serious disease and fighting for your life. The next issue with that is when you show symptoms, the first symptoms are quite non-specific. You look at someone who complains of a fever or a headache or sort of flu-like symptoms. You know, I'm often reminded of a case that happened at Potchefstroom University where a student got up this morning. She told a friend, "Listen, I'm not going to come to class. I don't feel well. I feel fluish. I'm just going to lie down." And you know, she was discovered a couple of hours later and rushed to hospital, seriously ill, and unfortunately passed away because of the disease. So it unfortunately has that connotation to it, but because it is quite serious, of course.
Are there other symptoms that we should be looking out for? So you said flu-like symptoms, maybe a bit of headache.
Especially in our children.
Especially in our children as well, yeah.
Yeah, so later the sort of typical symptoms present, and that's that neck stiffness. So we often see that especially in the children where they sort of struggle to put their chin to their chest. Other signs that are sort of typical of meningitis, they get the rash. The only issue is the rash doesn't always happen. So it's not like you can find that sign to say, oh, my child definitely has meningitis. So even when you present to hospital with the presenting symptoms, the doctors often have to work through a number of possibilities before they get to the diagnosis. So that's just tricky for a clinician to manage as well. So it's treatable. You can treat it with antibiotics, but looking at this sort of strange symptom presentation, you're against the clock. To get to it is then, I guess, prevention becomes a more important conversation.
A few more questions we'd like to ask the good doctor. We are talking about meningitis, I don't celebrate, but we recognise World Meningitis Day on the 24th of this month, an opportunity for us to raise awareness around a critical topic.
It's my feel-good breakfast show.
Welcome back to our Freedom Day celebrations. Yes, but also, lest we forget, it is a Tuesday, which means we delve into health topics, and continuing with today's discussion on meningitis with medical practitioner, medical head, Dr. Thinus Marais, and he is still with us. Meningitis can be a very serious disease. It is sometimes hard to detect, as we discovered in our first conversation, and can strike at any age, particularly with young people. So Dr. Marais is going to be telling us how the disease now is contracted and how it can be prevented and treated, probably the most important part. I've got to ask this because is it something that is contagious? How do we get it? Can one thing lead to that infection? How does it actually, and both the viral and the bacterial?
Yeah. So looking specifically at the bacterial one, so we call it droplet spread. So that's by close contact. So you get the organism in your, it's a big word, nasopharynx, but it's in your nose, sort of towards the back of your nose. It's called your nasopharynx. So a percentage of the population are actually asymptomatic carriers. So there's no other harborer of the disease but humans. So a percentage of the population are asymptomatic carriers, and they're then able to spread it to people who perhaps are a bit more prone to then
compromised
contracting the disease. Yes.
To getting the disease. Prevention is obviously better than cure. How can we then prevent ourselves from getting it? With regards to the
Please
vaccine,
don't say
is it
wearing a mask.
effective?
Please don't say wearing a mask.
Well, I mean, now that you say it, I kind of have to touch on it. So we have found that globally, because of our social distancing and mask wearing, the numbers have in fact dropped. But we know, from a sustainability perspective, we hope that one day we're going to go back to a bit more of a sense of normal, and then all of these respiratory contracted diseases obviously will see increase again, and then we need to look at something like prevention. And thankfully for the major bacterial causes, we have vaccines, most of those in childhood, obviously because children are a little more have a greater propensity to contracting the disease and a serious form of it. So that's why the vaccines are positioned for kids, but later in life also you may want to consider vaccinating. If you're a student, if you're traveling to a country that's endemic, those are sort of moments you might want to consider vaccinating again.
How do you check something like that? Where do we go to? Do we
Yeah.
go to Dr. Google? What's the best?
Well, I mean, I think in South Africa we actually have a great setup where a lot of our pharmacies now have nurses in them, and a lot of these nursing practitioners are actually very well schooled in terms of what vaccines you can receive. So that's a good spot to start. We have a great network of travel doctors and practitioners in South Africa, and your generalist or your general practitioner will certainly be able to
I'm phoning you, my
assist
friend.
you.
I'm phoning you, buddy.
Of course, you're welcome to.
We spoke about the vaccine, but what other treatment options are available if you do contract meningitis?
Yeah, so like I mentioned, it really is treatable. So there's good antibiotics to treat it with if you're diagnosed. The only issue is that you're sort of running this race against time. And despite treatment with antibiotics, depending on how far the disease has progressed, it does have what we call quite serious sequelae. So that could be loss of limbs, it could be loss of hearing in the case of kids.
What does it actually do? Sorry to excuse me interjecting, but it seems so damaging. What does it do within the brain that causes
So two
that?
sort of major presentations is the meningitis presentation, which then anything related to your brain, you know, when we look at kids, that generally impacts their developmental state and their milestones quite intensely, and everything around your brain. So that's where the hearing loss could come in as well. And then if it presents with what we call a septicemia, which is more a blood-derived infection, any kind of end organ damage. So that's sort of where you get loss of limbs or maybe loss of organ function. So people lose kidneys, or so yeah, it's terrible. But yeah, like I said, let's focus
It is,
on the
but it is
part of it, I
preventable,
guess,
and there are vaccines available, and we seem to be sitting at the forefront of that. Thank you so much for terrifying us this morning, but also informing us and making us feel a little bit more comfortable that we're in good hands when it comes to our local medical practitioners, and your pharmacists can really help as well. We'll hone in on a brilliant pharmacy a little bit later in the show. Right now, let's fill those tummies with something that's going to boost our health and our immune system.